Look at your ankles right now. Press your thumb into the skin just above the ankle bone and hold it for 5 seconds. Now release. Did the skin spring back immediately, or did it leave a small dent, a pit that stayed there for a moment before slowly filling back in? That 5-second test has been used in clinical medicine for over a century, and what it reveals is not a skin problem, not a circulation problem, not something you ate. In millions of people over 50, that small pit is one of the earliest visible signs that the kidneys are no longer keeping up. Most people have no idea their kidneys are in trouble until the damage is already severe. Not because the warning signs are invisible, because nobody told them what to look for. The kidneys have no pain receptors. They cannot hurt. They will lose 50, 60, even 70% of their function before producing a single symptom that most people would recognize as serious. By the time a standard blood test catches the problem, it is often years into the process. I'm Dr. Arthur Sterling. Subscribe right now and hit like. What I'm about to show you, your doctor will not cover in a 7-minute appointment. To understand the warning signs, you need to understand what the kidneys actually do, because most people dramatically underestimate it. Your kidneys are 2 fist-sized organs sitting just below your rib cage on either side of your spine. Every single minute, they filter approximately 1 litre of blood. Over 24 hours, that is roughly 180 litres of blood filtered, producing about 1.5 litres of urine as the byproduct. But filtration is only one of 6 critical functions your kidneys perform simultaneously. They regulate blood pressure by controlling fluid volume and producing a hormone called renin. They produce erythropoietin, the hormone that signals your bone marrow to produce red blood cells. They activate vitamin D, converting it into the form your body can actually use. They regulate the acid-base balance of your blood, and they filter out metabolic waste, the byproducts of every biochemical process happening in your body every second. When the kidneys begin to fail, all 6 systems begin to fail with them, simultaneously. And each one produces its own set of signals. Signals that are easy to misread when you do not know what you are looking for. The medical term for declining kidney function is chronic kidney disease, CKD. It is staged from 1 to 5, with stage 5 being kidney failure requiring dialysis. The critical clinical fact: stages 1 through 3 produce almost no obvious symptoms. Most people with early to moderate CKD feel entirely normal. They are not normal. Their kidneys are quietly losing ground every month. Here is the number that should concern every person over 50. Approximately 37 million Americans have chronic kidney disease. Of those, an estimated 90% do not know they have it. Not because they have not been tested, because the standard annual blood panel does not always catch early kidney decline. And even when it does, the result is rarely explained in a way that motivates action. Here are the 7 warning signs. I want you to go through this list honestly, not to alarm yourself, but to give yourself information your body has been trying to deliver. Sign 1. Pitting edema. The ankle test. When the kidneys cannot efficiently remove excess fluid from the body, that fluid accumulates in the soft tissues, particularly in the lower legs, ankles, and feet, because gravity pulls it down. Press your thumb firmly into the skin above your ankle bone for 5 full seconds. If the indentation remains visible for more than 2 seconds after you remove your thumb, that is pitting edema. It means your body is retaining fluid it should be excreting. This is one of the earliest and most reliable physical signs of kidney stress. It also appears in the face, particularly around the eyes in the morning. If you consistently wake up with puffy eyes that take an hour or more to resolve, That pattern deserves investigation. Sign 2. Changes in urination that seem minor but are not. The kidneys produce urine. When they are under stress, urine production changes in specific, recognizable ways. Foamy urine, persistent bubbles that do not dissipate after a minute, indicates protein in the urine. Protein should not be in urine. Its presence means the kidney's filtration membrane has been damaged and is allowing molecules through that it should be blocking. This is called proteinuria, and it is one of the earliest laboratory signs of kidney damage, but you can see it yourself before any test. Urinating more frequently at night, nocturia, is another signal. Healthy kidneys concentrate urine at night so you can sleep uninterrupted. Damaged kidneys lose this concentrating ability and begin producing dilute urine around the clock. Dark brown or tea-coloured urine without obvious dietary cause, beets, certain medications, can indicate blood in the urine, which requires immediate evaluation. Sign 3. Fatigue that feels different from ordinary tiredness. When kidney function declines, two things happen that produce profound fatigue. First, the kidneys reduce production of erythropoietin, the hormone that tells your bone marrow to make red blood cells. Fewer red blood cells means less oxygen delivered to every tissue in your body. This condition is called renal anemia, anemia caused by kidney failure rather than iron deficiency. Second, metabolic waste products that the kidneys should be clearing begin to accumulate in the bloodstream. This toxic buildup, called uremia in advanced stages, produces a heavy brain fog, difficulty concentrating, and a physical exhaustion that sleep does not relieve. If your fatigue is accompanied by pallor, paleness of the skin, the inner eyelids, the nail beds, that combination points directly toward renal anemia and warrants a blood test. Sign 4. Persistent itching with no skin condition. This one surprises almost every patient I mention it to. When the kidneys cannot clear phosphorus from the blood, a mineral found in virtually all protein-containing foods, phosphorus levels rise. Elevated phosphorus in the blood triggers a cascade that ultimately deposits calcium phosphate crystals in the skin. These microscopic deposits cause a deep, persistent itch that no cream or antihistamine relieves. Patients describe it as coming from under the skin, not the surface. It is most pronounced on the back, arms, and legs. Dermatologists treat these patients for years without result because the cause is not in the skin, it is in the blood. Sign 5. Metallic taste in the mouth or ammonia-like breath. As waste products accumulate in the bloodstream, particularly urea, the breakdown product of protein, they begin to affect taste and smell. Urea is converted to ammonia by bacteria in the mouth. Patients describe a persistent metallic taste, food tasting different than it used to, or a smell on their breath that others notice. This is one of the more advanced early signs. It indicates waste accumulation is already measurable. If you have been experiencing unexplained changes in how food tastes over the past few months, this symptom deserves attention. Sign 6. High blood pressure that is difficult to control. The kidneys and blood pressure are locked in a tight regulatory loop. The kidneys produce renin, a hormone that controls blood pressure by regulating fluid volume and arterial constriction. When kidneys are damaged, this regulation becomes erratic. Blood pressure rises. And here is the trap. High blood pressure also damages kidneys. Each accelerates the other. This is called the cardiorenal syndrome, a self-reinforcing cycle where kidney damage drives blood pressure up and elevated blood pressure drives further kidney damage. If you are taking 1, 2, or 3 blood pressure medications and your pressure is still difficult to control, kidney function should be evaluated, not as a possibility, as a priority. Sign 7. Pain or pressure in the lower back, flank, or below the rib cage. The kidneys themselves have no pain receptors, but the capsule surrounding them does. When the kidney swells due to obstruction, infection, or cyst formation, that capsule stretches and produces a deep, dull ache in the flank, the area between the lower ribs and the hip on either side of the spine. This is distinct from muscular back pain. Muscular pain changes with movement and position. Kidney pain is persistent, deep, and does not respond to position changes or stretching. A kidney stone produces a different quality, sharp, severe, often radiating to the groin. Both require evaluation. Neither should be dismissed as a pulled muscle. Let me tell you about a patient I will call Margaret. 61 years old, retired schoolteacher. She came to see me because of itching. For 8 months, she had been seeing a dermatologist for what had been diagnosed as chronic dry skin and mild eczema. She had tried 4 different creams, 2 antihistamines, and a course of mild steroids. Nothing worked. The itch was deep, she said, not on the skin, under it. I asked her 3 questions. Did she notice foamy urine? She paused. Yes, actually, for several months she had assumed it was the water. Were her ankles ever puffy by evening? She rolled up her trouser leg. I could see the indentation left by her sock elastic clearly. It had not bounced back. And had food been tasting different lately? She looked at me and said, "Everything tastes slightly metallic. I thought it was my medication." 3 symptoms, 8 months. 1 dermatologist appointment after another. Nobody had connected the itch to the ankles to the taste, because nobody had asked all 3 questions in the same room. I ordered a basic metabolic panel and a urine microalbumin test, a sensitive measure of protein in the urine. The results came back within 48 hours. Her GFR, glomerular filtration rate, the standard measure of kidney function, was 41. Normal is above 60. She was already at stage 3 chronic kidney disease. Her phosphorus was elevated. Her urine showed significant proteinuria. Her kidneys had been declining for an estimated 2 to 3 years. Margaret had been treated for a skin condition she did not have for 8 months, while her kidneys continued to decline. The dermatologist was not wrong to treat what was in front of them, but the itch was never in her skin. It was in her blood. 3 questions and 1 blood test changed the entire trajectory of her care. With dietary modification, blood pressure management, and nephrology follow-up, her kidney function stabilized. She did not need dialysis. She will not need dialysis if she continues her current protocol. The difference between that outcome and a very different one was a single appointment where someone asked the right questions. Now let's talk about what actually damages kidneys, because most people point to one cause and miss the others entirely. The 2 leading causes of chronic kidney disease in the United States are diabetes and high blood pressure, together responsible for approximately 75% of all kidney failure cases. Diabetes damages the small blood vessels inside the kidney's filtration units. High blood pressure damages the larger vessels supplying the kidney. Both processes are slow, silent, and cumulative, but there are causes that most people and many physicians overlook entirely. Chronic NSAID use. Non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, aspirin at high doses, are among the most commonly used medications in adults over 50. Taken occasionally, they are safe. Taken regularly for months or years for chronic pain, they constrict the blood vessels supplying the kidneys, reducing filtration pressure and causing progressive damage. Many people taking daily ibuprofen for arthritis or back pain have no idea they are slowly damaging the organs filtering their blood. Dehydration. Chronic, low-grade, daily dehydration reduces kidney perfusion over time. Contrast dye used in CT scans and cardiac catheterizations can cause acute kidney injury, particularly in people with pre-existing kidney vulnerability. And certain herbal supplements, aristolochic acid found in some traditional herbal remedies, high-dose vitamin C, chromium picolinate, are directly nephrotoxic, toxic to the kidneys. After 50, kidney function naturally declines at approximately 1% per year, even in completely healthy individuals. That baseline decline means that any additional insult, diabetes, blood pressure, NSAIDs, dehydration, produces a larger proportional loss than it would at 30. The margin is smaller. The consequences of the same habits are larger. The standard annual blood panel includes a creatinine measurement and an estimated GFR. Most physicians glance at it, confirm it is within the normal range, and move on. What most people do not know is that creatinine, the waste product used to estimate kidney function, does not begin rising significantly until kidney function has already declined by 50%. You can lose half your kidney function and still have a creatinine level that falls within the normal range on a standard blood test. The test is not wrong. It is just measuring the wrong thing for early detection. The more sensitive test is urine microalbumin, a measure of protein leaking through the kidney's filtration membrane. It detects damage years before creatinine rises. It is not part of a standard annual panel. You have to ask for it specifically. This is not a flaw in your doctor's care. This is the architecture of a system designed to treat established disease, not to detect it in the years it spends quietly developing. Here is what to do starting today. 1. Do the ankle test right now. Press your thumb above the ankle bone for 5 seconds. Note what you see. 2. Look at your urine tomorrow morning. Persistent foam that does not clear within a minute warrants a urine test. 3. At your next blood draw, ask specifically for urine microalbumin and a cystatin C level, a more sensitive kidney marker than creatinine alone. 4. If you take ibuprofen or naproxen regularly, speak to your doctor about alternatives. 5. Drink water consistently throughout the day, not in large volumes at once, but steadily. Chronic mild dehydration is one of the most correctable kidney stressors that exists. 37 million Americans have chronic kidney disease right now. 90% do not know. That is not because they have not been paying attention. It is because nobody showed them what to pay attention to. The ankle test takes 5 seconds. The urine test takes 1 morning of observation. The blood test costs nothing if it is added to a draw you are already having. How old are you? Write it in the comments right now. I want to know who is watching, because the kidney risk conversation at 52 is meaningfully different from the one at 68. And I want to make sure what I cover next speaks directly to where you are. Here is your complete action plan. 1. Ankle test today. Both legs, 5 seconds each. 2. Observe your urine for foam and colour for 3 consecutive mornings. 3. Request urine microalbumin and cystatin C at your next blood draw. 4. Review your regular medications for NSAIDs and discuss with your doctor. 5. If you have diabetes or high blood pressure, both of which you may have been told are well controlled, ask your doctor specifically when your last kidney function test was. 6. If you have 3 or more of the 7 warning signs I described today, do not wait for your next scheduled annual physical. Request an appointment this month. Your kidneys have been filtering your blood without a single complaint for your entire life. They deserve 5 minutes of your attention today. I'm Dr. Arthur Sterling. I have spent 15 years watching patients arrive after the damage was done, wishing someone had shown them this list years earlier. Subscribe, hit like, and send this to someone whose kidneys you want to protect. The healthcare system profits from treating kidney failure. I profit from making sure you never get there.